Hello, everyone, and welcome to our live discussion here in Paris at the TSE conference. Today, we are exploring one of the most exciting frontiers in endodontics, pulp regeneration.
Oh,
Research is now pushing us to ask a bold question. Can we really bring dead pulp back to life? Today, we are joined by two leading voices in this field. Professor Alexis Gaudin, a leader in regeneration research, and Professor Turk, who bridges laboratory science and practical care. Let's start with the fundamentals. Professor Alexis, what exactly do we mean by pulp regeneration and how it is different from revascularization and conventional root canal treatment?
okay. It's quite a big question. If you want to be short, I would say that pulp regeneration means that we want to regenerate the whole tissue. It means in terms of structure, but also in terms of function. So we want to get the same cells, same vascularization, same immune answers. So this is the regeneration ad integram of the tissue. This is totally different from what we do usually, like root canal treatment. That means we clean the tooth, we shape, and we obturate in order to maintain the result of the disinfection. And the revitalization is another clinical process where we want to attract cells and blood from the periapical region inside the tooth in order to get one another connective tissue that is considered as healing, which is different from regeneration.
Thank you for your answer. And Professor Tuba, why is this topic gaining so much traction? What has changed in the past decade that makes pulp regeneration feel more realistic than ever?
Yeah, thank you. Because it's very inspiring area because like me, many of us is getting exciting about this because we want to regenerate the tissue. We don't want to use sensitive materials inside the root canal for obturation. So it's much more effective to use cells and also to use biological materials to do the obturation. I think it would be much more functional for tooth. Yeah.
Thank you. Professor Alexis, imagine a tooth coming back to life. What benefits would patient truly experience if we restored living pulp, giving the tooth structure and pulp vitality?
Yeah, there are many advantages for the vitality. So just the one that comes to my mind is you will get the immune answer, for instance. It means the ability of the tooth to defend itself against bacteria. You will have the sensibility of the patient. You will avoid discorrelation. You will have also the biological process of healing we have inside the pulp with the tertiary dentin formation and so on. So there are many advantages to keep, restore, or regenerate the pulp if possible.
Thank you. And the question all goes for you again.
Okay.
Your lab works on cell-free pulp regeneration, yeah? Can you explain this approach in a simple terms and what is the difference with the traditional cell-based strategies?
I think Chuckback could complete my answer, but there are different ways of regenerative techniques, cells and cells-based and non-cells-based. It's a way to understand the difference, but it's, I would say, more complicated than that. And in the lab where I am, we also worked with cells. But one of the advantages of not of working without cells, it is maybe a simpler situation. You won't have less good manufacturing process to obtain to treat those cells, expand those cells, and so on. So you don't need that. And also there is an issue with the transplantation of those cells, about immune rejection. So the therapy without cells maybe could be as more a simpler way to treat.
Okay. So, Professor Tubam, from a clinical point of view, how ready are we to use these biological tools in patients? Are they practical or still experimental?
Thank you. It's a really great question because they are not laboratory studies anymore. We are using these techniques very successfully in our daily endodontic clinics because, as the professor said, there are cell-based treatments and cell-free treatments. Especially cell-free treatments are very easy to do at the clinical treatments because you don't need a special tools, you don't need a special laboratory. So also with EAE and ESC, we have a very good, well-designed guidelines. So we know what will we do in every step. So it's not a laboratory anymore. Is this part of our clinical treatment?
And again, the question goes to you. Which clinical scenarios are currently the best candidates for regeneration endo? Which clinical scenarios are the best candidates for regeneration endo?
You know, it has almost 20 years of history, isn't it? So it begins with the immature tooth. So at the beginning of this treatment history, this was a very good treatment for immature teeth because we had a lot of troubles while we were treating these kinds of teeth. So we know that it is the first treatment choice for immature non-vital tooth. But by the time I think it's changing, it will change to mature teeth. We know we need some time for it, but I think in the future it will be the best treatment choice for both of it.
But what are the obstacles for applying it to fully mature teeth nowadays?
Yeah, for mature teeth, we need more long-term studies. We need to learn more because we have a way to walk. Because there are some problems with the blood supply, and maybe the age of the patient can be considered a problem. We are not sure yet, but we have to be much more careful with the mature teeth.
And Professor Alexis, when you perform a regeneration endo, how did you define the success?
I'm sorry, I didn't hear
How did
the-
you find the success when you perform regeneration endo?
I would define the success. So success, we mean you can define the success at different level. Could be the level of the patient, the level of the clinician, and as we often read, or at the level of the researcher. But for the patient, he has to have no pain, no swelling, no discoloration of the tooth. As a clinician, what we want the healing on the radiograph. We want the bone to reconstruct. And from the researcher, the success would be to have the true regeneration of the dental pulp tissue.
So it means you want to reach the threshold outcome, yeah?
Yeah.
Yeah, exactly.
Is it possible?
We are working on it.
Yeah. Both clinically and also laboratory studies are very strong.
Okay. So looking ahead, what's the next big step to make pulp regeneration a standard option in our clinical practice?
Would you like to start or?
Yeah.
You can answer, bro.
As I said before, I think we need a very good long-term clinical studies. We already have some, but there are, in that studies there are some. They use some different protocols, so we need a good standard protocols, and we need some more experience to be much more certain.
And how about biology? How about regulations? And how about the clinical?
You want me to answer? I think, as you said, we need more studies, more clinical cases, more lab studies, more animal studies to increase the level of data we have. But in the meantime, we have regulation. Sometimes could be seen as a barrier. I don't think regulation is a barrier. They are really mandatory, but it can slow the process from the lab to the clinician. But I think we need that. So we have to take into consideration the scientific data we have,
Yeah.
the regulation that are and could be different also from one country to another. So we have to take this in mind.
Okay, so as we wrap up today's discussion on pulp regeneration, it's amazing to think that once we consider that pulp one day could be brought back to life.
Yeah.
Thank you very much for joining us and for sharing your insights and for showing us how science are pushing the boundaries of endodontics.
Yeah.
Thank you all for watching us. Don't forget to share the best moments on social media. Always exploring and always keep your pulp alive.
Yeah. Thank you so much.
Thanks a lot.
Thank you. The after party.